It's a rough one.
Yeah.
Hey, let's watch the feet.
It's just too bad.
She says, well, she stopped rubbing.
Some will Margarita. Take it to make it keep going.
And anytime she starts down,
Yeah, it stops. She says they stop, so if I kick, maybe I'll get.
that's okay.
Are they all inside or sorry?
All inside.
She says, excuse me, you're
It's a
not
little
doing
more
it.
difficult right now when the girls come in and season, but normally they're just like big furniture. People say, oh, they're
Like, blame us if that
like
was
a
tonight.
jogging wet. And they're not good for joggers, it's more like dragging around.
This is not bad.
Are they closed?
Good they sit.
They're good. Okay, how about it, Jennifer?
They don't even have a treat. What is it about these dogs that?
Magic
I
word.
love these dogs because of the love they give. And they're sweet, they're soft, they're cuddly. And it's interesting because we've talked about these dogs and how they bring comfort to people. And when my family goes out and does a presentation and talks about the dogs, I talk about comfort. They bring comfort and hope to people. And it was interesting because one day not long ago I was home and my granddaughter was at work and I was watching her dogs for her. And I laid down on my bed and Mishak came and got in bed with me. And these are big dogs and they're soft and they're cuddly and they're loving. And for the first time, and I've talked about it for a long time, but for the first time I personally felt the comfort. And I didn't want him to leave. And it's hard to explain. I think it's something that each person has to feel. The number one reason dog therapy works is because of unconditional love. These dogs don't care how old you are. They don't care if you're in a bed or in a wheelchair. They don't judge you. They don't ask questions about your illness, and they don't demand answers. They just love you.
How long have you had these dogs?
3 years.
And how long have you been working at this clinic?
8 years. Yeah, and so it was.
What kind of sparked that when you thought, I'm going to bring my dogs to the place I work?
Because I loved them so much and I saw what they brought to others, and I thought, this is a good opportunity to bring the dogs here for the cancer patients, and the reaction has been really wonderful. It's been wonderful. One of the RNs told me one day that there was a patient who never responded, was quiet, didn't talk, just despondent, and then the dogs walked in and they said they saw a whole different person.
Because these started off as show dogs?
They
weren't originally therapy dogs.
They were originally service, therapy, and they are show dogs.
And you thought, well, this would be a perfect environment for
This is
them.
a good environment. The number one training for service and therapy dogs is socialization. They need to be around all kinds of noises and people and activities. So the number one place to take a dog for socialization is a dog show.
What's going on there? Are they all related?
And they are all from a wonderful kennel in Austria called Shadows Eternity. And they are known for their beautiful dogs and also dogs that have sweet service temperaments. And they've just been wonderful to my family. Our dogs are all from that line. And they've been real good to us. And we have beautiful dogs that have that natural service temperament. And it's really wonderful to see.
Yeah. And we talked a little bit about this and, your comfort level and what you feel, but you got these dogs for a pretty personal reason too.
Yes, and our family at the time was looking for a service animal, and we did a lot of research. It's important that you research what kind of dogs do you like. Do you like big dogs, little dogs? Any dog can be trained, but we needed a gentle dog. And we learned, a lot of people will say, oh, these dogs are so big. They're big, yes, but they're very gentle, and they're very loving. They're very loyal. Froggy's very loyal. Shelby is natural service temperament. She's a natural working dog. Shadrach, the big male, he is really in tune to people, how they're feeling, their emotions, and he also loves children. And so it's just something to be great to be a part of and to see what they actually do for people, just to bring the joy and the smiles on their faces. Even in the chemo suite here, in the staff, you know, we have staff that love to see the dogs as much as the patients do.
Do you think every clinic, hospital out there should have some kind of animal therapy?
Oh, absolutely. Absolutely. I mean, because I see it and I live it every day. And I think it's great. I think it's powerful. I think there's a connection between animals and people that is just beautiful and wonderful. And these dogs bring a lot to others, and we're thankful for them and for all that they do for us.
And remind me how often you bring them again?
We bring them about every other Friday, twice a month. We try to. We try to bring them twice a month, and because of their size, and we always go back and ask the patients first if they would like to see the dogs, because there are people who are dog lovers, and we don't push them on anybody. And then the patients that want to see them, it's just so wonderful to see just their faces and how happy they are, and so it's a real blessing to bring them in. And yes, I definitely think dog therapy is wonderful for clinics and hospitals. Absolutely.
Ellen, anything?
You're just a natural. You just go.
Give me your first and last name and spell it so I have it.
Susan.
Yep.
Rezenchek, REZNIC.
And what else do you want us to know?
Did I not ask you something, or you want to talk about something that maybe I didn't touch on?
I think we covered the basics. What do you guys think? I'm getting a thumbs up from staff.
I think a lot of it has to do with, you know, if you can imagine going back into the chemo room and you're getting this poison put into your veins, and, you know, there's things going around in your life that you're worried about and concerned about, and these dogs come in and, you know, they don't care about that. They're not here to pity you. All they want to do is love you and, you know, get some time with you and be able to give you some warmth and joy. And Susan's got a billion pictures. I exaggerate just a little. Just these patients that have these ear-to-ear grins, and it's wonderful that, you know, you can be in a chemo room and have that joy.
And do you see the differences at night and day from the 2 years that they've been here?
I would say so.
We have some people that are actually, you know, when are the dogs
When
coming
are the
back?
dogs coming?
Now, here's a weird question. I have not had cancer or chemotherapy, but I have been in there, and you know, you put it in, and boom, within 30 seconds, people are sick and stuff like that. Do these animals have any effect on maybe the nausea or anything? I mean, that would be big if it was.
I think it just gives them something else to think about besides basic.
mainly see when I go back there is, you know, you come into a room where nobody's talking, and everyone's depressed and sad, and then when we leave, they're talking a mess. We used to have a dog that, you know, I remember my old dog, or I'd love to have a dog again. And then they all have something to talk about, which I think is good, instead of sitting there just quietly.
It might have an effect, maybe not visually, because they might still have the illnesses from the poisons and stuff. But,
Oh, yeah.
But they're
Absolutely. It's the difference from when we go in to when we leave is nice.
And how long does the chemo session last? Does it vary, or
It can vary.
like how long can somebody sit
They
there?
can be here for 20 minutes to 8 hours.
Yeah.
They could be here all day.
So to have that little bit of
Absolutely.
You know, a big part of nausea is anxiety and anticipation, and these dogs just calm that
well,
down.
that's what I
So
was
it's an
wondering.
anti-anxiety
That
effect.
could be something that you could quantify, is what I was kind of, or somehow physically check mark or something like that, if it was something. Yeah, and that's fabulous, but I want the Cocker Spaniel.
He's like, you're right.
I'll change my name to Ricky.
Okay, now who's next?
And then I'd like Dr. Fielder.
I think, could we get, are you comfortable putting a mic on, maybe talking some more medical terms of how this can help?
Okay. Ricky, come.
She wants to talk about Ricky real
Come
quick.
here, Ricky.
Oh, on camera.
Oh, absolutely.
Okay, I'm good with that.
The smallest Newfoundland. Because he thinks he is a Newfoundland.
This is Ricky. Ricky is a Cocker Spaniel that was left in a dumpster in a park to die when he was a little puppy. He was taken to a shelter, and my family were taking the Newfoundlands to visit the shelter, and they took some blankets and towels to donate. And my daughter went in the back, and she saw little Ricky. His body was shaved. He had no hair. He had been very sick, and nobody wanted him. So he came home with my daughter. And he's basically been raised by the Newfoundlands, so he does think he's a Newfoundland. He even weighs like the Newfoundlands. And of course he isn't, but he's a very sweet boy. And we visit nursing homes and schools. We go out with the dogs a lot. And Ricky likes to get in people's laps and kiss them in the face. And they just love him. Because he's easy. He sits in their lap. You know, a Newfoundland will, but it's a little different. we don't allow that.
How old is he now?
Ricky is 2 years old. You're a good boy. And he's the Newfoundland's favorite toy. Okay, Ricky, you can get down. Here's my lady. Here she is.
I'll let you drop that through there.
Oh. Says I did my interview well, so I could have candy.
Makes that really nice.
Shoot up a little bit.
Could we go, do you want to do it in here, or maybe like her office, or like more?
Yeah, maybe a little bit more medical-y.
Yeah.
Medically?
Medically.
I like that term, medically.